High blood pressure is a major risk factor of stroke. Welcome to Gerard Board. Please help us to subscribe, like, and comment your views on this particular video. In today's episode, we are going to be discussing the causes of stroke. This video will help you to understand what stroke really is and will give you a greater insight about the risks associated with stroke. Normally, blood vessels called arteries carry blood to the brain. They supply the brain with oxygen and other nutrients to enable its functionability. During a stroke, also known as brain attack, blood flow to the brain is blocked. The most common type of stroke is called ischemic stroke. It can happen in an artery where a fatty substance called plaque has made the artery narrow in one type of ischemic stroke. It is called a thrombotic stroke. The plaque can break apart from a blood clot that blocks the flow of blood to the brain. Another type of stroke called an embolic stroke. A blood clot forms in another area of the body and travels through the bloodstream. When it reaches an artery near or in the brain, it can block the flow of blood. During a stroke, when oxygen and other nutrients cannot get to the brain cells start to die off within some few minutes. A less common type of stroke is called a hemorrhagic stroke. It occurs when there is a weakened blood vessel and this blood vessel is ruptured, and by rupturing there is a leakage of blood. And when there is a leakage of blood, that blood that is coming out from that leaked part will put more pressure on the brain tissues, which will now cause a hemorrhagic stroke. A clot blocks the flow of blood to the brain, but it's different from the other types of stroke because the clot breaks up after a short time. Transient ischemic attacks usually don't cause any permanent effect on the brain. High blood pressure is a major risk factor for any type of stroke. Other risk factors are diabetes, smoking, high cholesterol, and having previous ischemic attacks. It's important to know these signs and symptoms of stroke because most of them are the risk factors associated with them. A sudden weakness in your body, a sudden weakness in your arms, your legs, and your general body, most especially at one part of your body, is a major sign and a major symptom of stroke we're talking about. Other signs are confusion, difficulty in speaking or talking, loss of balance or inability to walk, sudden severe headache and fever. To know more about your risk factors, please do well to visit medical practitioners and take care of yourself by going for regular checkups. Please don't wait until diseases or issues get out of hand before you locate the nearest clinic or hospital for diagnosis. Please stay safe out there. God bless you and thank you for watching Gerard Board.